Good afternoon, everyone. Thank you for tuning in to the She Shares conversation. You aren't alone, dealing with mental health challenges. My name is LaKenya Jordan, and I'm a longtime supporter of She Shares and a volunteer who mentors women along with the other fabulous and panelist women you'll hear from today. Today is an important conversation because we know women are really dealing with mental health, and more now than ever, we are feeling isolated and alone. We want you to know today that you're not alone. The panelists you'll hear from today are going to share with you their knowledge and history about the topic of mental health and some coping strategies. On our panelists today, we have Dr. Tam Nguyen, Ph.D., a clinical psychologist and director of ambulatory care for mental health and addiction at Sutter Health. Dr. Nguyen's many accomplishments includes her leading the rapid adoption of telehealth for mental health, which I know is so important in this time. And she's also developing digital mental health programs for youth ages 12 to 26 years old to help them manage depression and anxiety. She's also a mother of two. Dr. Hilary Van Horn-Gatlin is also a PhD and clinical psychologist and director of organizational leadership at Kaiser. Dr. Van Horn-Gatlin is passionate about removing health disparities from our community and providing mental health support to all. She's also a mother of three. Eva Schwartz is a mom of two young boys, like myself. Based in Sacramento, she is here to share her story of suffering from postpartum psychosis after the birth of her first son. She had never struggled with mental health before, but now she wants to share what she's learned from her experience, which I think we all will find very valuable and possibly invaluable, because if it's not you, it's someone else maybe that you know might be going through something similar. And here to moderate this conversation today is Senator Susan Eggman, who represents the 5th District in the Senate and covering San Joaquin, Stanislaus County, Galt, Sacramento, and she is passionate about mental health. She's a master's and PhD in social work. Before running for office, she worked as a licensed clinical psychologist and social worker and professor at Sacramento State University. She will bring to this table the lens, along with her nearly 2 decades in the legislature, a conversation today that will hopefully be robust and fulfilling, that I think you all will learn from. Senator Eggman is also raising her daughter, Emmy. So we thank you all for tuning in today. We hope that you find the conversation enlightening. There's also some resources we have available online for you at sheshares.net. So please welcome our wonderful speakers to the virtual stage.
Good afternoon, and thank you everybody for having us here today for this conversation. I think we're all very excited to be here with you today. And before we get started, I guess this is part of getting started, but just to acknowledge that this is a group of women who tend to be very together, right? Like part of our role in life is being together, being able to handle anything that comes our ways, being buttoned up and prepared for chaos if it should ensue, and trying to make things work. That's what we kind of do professionally, and then put on top of that the pandemic, right? You put all that on top of it, that we're still thinking we're doing everything we're doing at the same time, right? Our kids are homeschooling. We're afraid about being ill. Our families, people are being laid off. There's financial issues. Some of us are caregivers of grown-ups as well. We know in our society, there's not paid family care for everybody for everything. And so the finances are stressful as we try to navigate. And then there's so all of that in itself creates depression and anxiety. And then put into that, really clinical issues that can arise either just naturally or sometimes from situations. So we're going to have that conversation today. So I want to thank kind of the wisdom of the group for saying, let's actually have this conversation, because as women, we've been talking for generations. It's what we do, is we come together and we talk and we think we can figure it out. But there are times when we have to reach out beyond our circles to professionals, and knowing what signs and symptoms are to be able to know when it's time. And I think it would be fitting to acknowledge that in our capital community, we lost somebody this last year, Nina Kapoor, who was a member of this group. As people know, she had some struggle with some mental health issues, and then after the birth of her child, committed suicide. So we also, I think a lot of people through that felt like, could I have done more? What should I have done? What should I have looked for? And so this conversation comes from that, right? And so like anything in life, I don't think we can expect it to be like in a little box, even though we're in boxes. But it might get messy, and it might, but we're going to do our best to get through this all together. And so I just want to, again, thank everybody for having the courage to show up today, to be able to have this conversation. I want to thank all of our guests, Eva for sharing her personal perspective and experience, and then our two doctors who are going to share their professional kind of stories around this. So I guess I just start off, we all come to our work in certain ways. If I could start off with Dr. and I'll say Dr. V, because we already said your full name. And then just tell us like how you came into the field and why you decided to focus on women in specific. Before we asked Dr. Nguyen to share that for her own journey.
Absolutely. I actually stumbled into maternal mental health. I originally was a pediatric psycho-oncologist, and it was remarkable to me working with children with cancer, how much, especially women, were going through, and the guilt and the struggles that they carried trying to take care of the children that were at home while also taking care of their child that was in the hospital. All of the doctor's appointments, everybody always comes first with moms to begin with. And then you layered on a medical crisis, and just the incredible struggle and strength that these women shared was just remarkable to me. And one of the things I found most telling that I can connect to a certain degree as well is this sense that, no, I'm okay. I just need to focus on my child. I just need to focus on, this priority, and that constant sense of prioritizing everybody but ourselves. And so when I came to Kaiser and restarted our behavioral medicine program at South Sacramento, we really had our eye on what it looked like to provide clearer and consistent care in women's health. And that's how I got started.
Mm-hmm. That's fascinating. And you're right. It's that whole guilt that we have of putting ourselves first is one of the biggest barriers to get to even asking for help. Dr. Nguyen, how about you? How did you come to the field and focus on women's mental health?
For me, at a very young age, I knew that I wanted to do something in psychology because growing up, physical health was really emphasized in my family, and mental health was almost dismissed or considered non-existent. And as a child, I observed that was really inconsistent with my own experiences. And as I talked with my brothers and sisters or my friends and family, it also felt really inconsistent with their experiences. So it was always something that I wondered about and wanted to know more about. As it turns out, in terms of connecting with women's mental health, perhaps like Dr. V, mine was a little bit circuitous. It wasn't straightforward. I started working with adults, doing neuropsych assessment, particularly with veterans. And as part of my fellowship at the National Center for PTSD, I had the opportunity to work with women veterans in the residential program. And they were a smaller program, and I did weekly groups with them. And there, I really felt the connection of working with women, the importance of calling out some of the specific issues and things that are specific to women and women health. And that's really where my journey investment in women's mental health began.
Okay. And then just kind of playing from there, Dr. V, if we can go back to you, because you both kind of identified there are things unique to women as we're just kind of going through life that tend to come up over and over again. Can you identify and help maybe our viewers identify what are some of those things that are unique to that women struggle with in specific as we deal with issues around mental health in navigating life?
Absolutely. I mean, as Dr. Nguyen and I were talking about yesterday, there are so many gendered and societal expectations on what it is to be a woman, what it is to be home, what it is to be a female leader, what it is to be a mother. And those are expectations that I do think are absolutely exacerbated by a lot of what we're seeing in social media, in particular right now. And I think COVID really blew the top off of our house of cards that many of us have created just to keep going. And I think underneath a lot of it is this sense of what probably many women experience here, which is this superwoman syndrome, which is I have to do all of the things. I have to be able to multitask. I have to keep all of the balls in the air. And I'm expected to be a certain way for other people. And for most of us, at no time as we're growing up and developing, and most of us have also not seen in our families, our own mothers put themselves first. Oftentimes it's, I have to take care of everybody else. And then if I have a moment, I'll eat. If I have a moment, I'll take care of something that I really want to do. I'm the last to bed, the first to rise. And so these messages and almost the rules that we then create for ourselves really escalate a lot of the psychiatric symptoms that many women will experience in their lifetime.
Mm-hmm. And Dr. Nguyen, would you the same or different that have you experienced as Dr. V?
Yeah, I would absolutely agree with that. And I'll add that I think modern women have an evolving identity, right? So now it's the balancing of work and being able to manage the home or family life versus maybe if we go back 10, 20 years ago, the identity of a female or a woman was more closely aligned to stay-at-home mom, right? Or really being the primary caregiver. But as the role has evolved, our expectations for ourselves and by others in our community have not changed. If anything, it's gotten to grow where we are asked to continue the role of being the primary caregiver in the home setting and to also excel in the workplace setting. And I think those are, just as Dr. V called out, unrealistic expectations. And so it's about noticing perhaps some of those unconscious expectations that we have on ourselves that others aren't that isn't really in our environment or can be, but noticing that and saying, is this realistic to be?
Mm-hmm.
And what is more fair? What is more realistic?
Mm-hmm. And do you both, I mean, you work with your clients, do you have people to really try to identify what some of those unrealistic expectations are that we have? Because they become just so automatic, like getting ready for a Zoom. You can have your sweats on the bottom, but you're looking all, and your background's good, right? You try to get the dogs and the kids quiet for a minute. How do we identify even what those are that are unrealistic because they've just been part of our fiber? Dr. V, you want to start?
Yeah, absolutely. I was going to say, I think a big part of it is many of us have rules and things that have to happen to have a good day. And so oftentimes I'll start there, like on your best day where you're doing all the things, what are those things? What are the rules? Sometimes they're very overt and explicit. And sometimes, to Dr. Nguyen's point, it's so much more unconscious. So taking the time to kind of peel back the layers on that and recognize, I think even just when we start feeling really itchy in our own skin, can be a good sign that something's not going according to plan or the way we want it.
Our rules that we had set out for the day, right? Our checklist. Yeah. Dr. Nguyen?
And I'll just add, I think the rules that we think others have been placed around us, right? And through our learning, observing our mom, our sister, thinking I must be like that as well, right? And so there are, in the world of psychology, we have this concept of unhelpful thinking patterns or cognitive distortions that we learn through history, through our own history and that of those in our lives or in our circle. And it's not a conscious learning, but we get reinforced for certain kinds of things that we do, right? And so that is then repeated over time. So I think it is helpful just to pause at the beginning of the day and say, and ask yourself, what is it that is most important to you? I always go back to values. And if we were to talk about being a value as a woman, what's the most important to me in terms of my values as being a woman, and what do I want my daughter to see each and every day explicitly, so that I'm passing those forward. And not that we will be perfect at that, as we definitely mess up. I have missteps every day, but I consciously try to call that out so that it's intentional as I think about that, because otherwise, when we're under stress, we're going to do what's easiest for us, right? What we've learned in our history. So we do have to pay attention, be present to what's happening in the here and now.
Right. Yeah, we go back to this kind of the way we've always done it. I used to use an example in my class all the time, like, people who cut off the ends of the ham, and they said, that's why you cut off. Why do you cut off the ends of the ham? Well, that's how my mom did it. Ask your mom. Why'd you cut off the ends of the ham? Well, that's how Grandma did it. Ask Grandma. Grandma said, we only had a small pan. That would how to make it fit in the pan, right? And so you kind of think about it. We all have different sized pans now, and the goal was just getting something done, right? So these rules that we have in our head that are based on old history.
Yeah, and at the time of history, it worked, right? At the time when that was created, it made sense. And it's that we haven't adjusted, though, because we are going based on automatic behaviors versus noticing. Does that make sense for my environment and my situation today?
Right. Yeah. From big things like that, or just sometimes like there's a traffic jam and you can that's the way I go to work, versus saying, well, let me go a different way, right? Just let me try a different way. So Eva, as we're talking about how people got into the field and how to look for kind of warning signs, can you share with us a little bit about did your story, kind of lay out for us that you didn't realize you had any kind of issues with mental health until you gave birth to a beautiful baby, and were set out to do this and help us understand.
I thought it would be easy, honestly, a little bit. I thought that having a kid would be easy because everyone was like, you've never imagined any big changing diapers and how stinky they were. Well, I'd been the primary caregiver for my dad after he had a stroke, and I changed his diapers for 1.5 years. And at least with a new baby, the baby doesn't have dementia and tell me that I'm trying to kill him. So I thought that a baby would be easy in reaction. But I didn't expect the hormones to knock me out. And I felt so guilty because I couldn't take care of my baby like I wanted, because I could not breastfeed. And I ended up in the mental hospital. I couldn't sleep. And I got diagnosed with bipolar disorder after the baby was born. And the first 1.5 years of my first son's life was absolute hell. I was depressed. I mean, it's weird. I actually made a lot of friends, which was interesting. I did learn that I wasn't alone because I went to a lot of moms groups, not mental health ones, just like play groups with kids and with babies. And I talked to the moms, and there were a lot of moms who were going through what I went through, had the same issues, the same fears, the same, oh my God, I can't handle breastfeeding. Oh my God, you know, problems with the husbands. They were all having these issues, not as extreme as mine. Not they didn't end up in the hospital. They could cover it up, but they didn't want to take medication because they were so scared that they wouldn't be able to breastfeed. And to acknowledge that something was wrong, they couldn't do it. And I learned I wasn't the only one, you know, and then my second one came around. We planned for it. We had a second baby 5 years apart. And I was medicated this whole time. I was prepared. I had the greatest support network. I had an amazing OB psychiatrist. And I had my baby in June 2020, right after COVID hit. I didn't get postpartum depression.
Yeah.
I was medicated. I got my sleep. I let things calm down. I didn't burst into tears when the kid had to take a little bit of formula so I could get some sleep at the beginning. And now I have two wonderful kids, and my life is really good. And you know, but the bipolar was horrible, and
and it sounds like and kind of what Dr. Nguyen and Dr. V have been talking about, this idea of we have all these expectations that we put on ourselves. And especially as our role, just, you know, historically and in the world as women, that we're the ones who give birth, we're the ones who are supposed to care, and it's supposed to come natural, and it's supposed to be easy, and it's supposed to be the greatest thing in your life. And oftentimes it is not. I mean, it's for some very lucky women, I think it goes flawlessly, and even for that, I think it is not easy. And I can tell you, my child came into my life when she was a little bit older, and that still wasn't easy, right? It's not, because we have all these expectations, then we end up feeling like a failure, and then to top it off with huge issues like this. And then it sounds like for your next child, you had more tools in place to allow you to be kind of more realistic going into the experience, like this is going to be not an easy ride, and two, you had all your resources and kind of your self-care plans in place.
Yeah. And I had an opening. If I flip out, because I have been sick on the outside, I know that I have to go to a mental hospital. Like, my husband and I have an agreement. Now, I do know that when I'm manic, I'm going to fight it. Like, he knows this, but that he can commit me.
Okay.
And that was hard. And I do wish that for new mothers, they had a better, if a woman does have to go in inpatient, a better system, because it was truly traumatic the first time. I got PTSD. You know, your roommate is the guy who's a crazy person on the street, and they grabbed me, you know,
Right.
there were people in there who grabbed me sexually. Like, they don't watch. It's a little bit like prison. And being around, and you're not around any new mother. And if it had been something for new moms, that would have been helpful. But I did have to go.
Yeah. And so it sounds like, and we all continue to try to really focus on improving our entire continuum of care, so people don't have that kind of experience when they do have to reach a point where they have to be hospitalized. And I think one of the things that we've talked about, both with Dr. Tam and Dr. V, and with you, Eva, yesterday, about, I mean, these women focus on women's mental health, maternal mental health, just women's mental health in general, but there aren't enough resources. And perhaps, especially when we think about postpartum and maternal depression and issues, we should be able to have maybe some more specialized treatment focus. So, because again, when you're trying to just grasp the idea that you might be struggling with a mental health issue, but you don't want to see yourself like some of your worst fears that you've seen on the streets, and that's hard to take that identity into yourself when you're just trying to be a mom. So maybe being able to have something a little bit more specialized to be able to focus more on your own issues. So you feel, again, that part of community that you develop later with your support groups could have been helpful. Dr. V, would you agree that we need more specialized work?
We need more specialized work, but I think Dr. Nguyen is going to agree with me. We need more people too. I mean, we need more professionals in the field. It is, we are in a crisis state. And I think that I cannot say that more clearly. And I know that from the docs to truck drivers to everything, we're all talking about needing more people. But in mental health, we have a national crisis on our hands. And compared to other developed countries in the world, we rank lowest, although we have the highest level of distress. We have the highest level of mental health diagnoses. We have the highest level of substance abuse. And for women specifically, 1 in 5 women will experience some postpartum or peripartum, so before or after birth, mental health issue. And only 15% of women will actually receive treatment. And that is frightening. I think that's something that as a mother, as a daughter, as a sister, we are in this together. We need to be really asking some hard questions about how we get more people interested in working in mental health, how we get people and we encourage them to do this field. It's not an easy field to be in, but it is incredibly rewarding. And I also think that we need to really look at disparities in how people are able to access mental health resources. In rural communities, Black women alone are 2 times more likely to experience psychiatric distress in relation to the cumulative traumas that they experience across their lifespan. People in poor areas are less able to access care. So I think that there are levels to this that we are all part of, that we can all be part in solving, and that at times we're all culpable of when it comes to some of the crises in front of us.
In front of us, yeah. So she shares people. She shares people. We're also turning this into a recruitment for more mental health workers because we all certainly know there's a desperate need right now. Eva, go ahead.
I think that sometimes people, because women have the hormones, but I don't think that people recognize that often men have a mental health crisis too that doesn't get acknowledged as much. They don't have the hormones, but men are by and large involved in childcare a lot more than they used to be, and they have the expectations. Um, I have a lot of story. My friends have told me their stories because I was honest about mine. So like in my exercise group, like my friend told me her husband ended up with a bipolar diagnosis after giving birth. After she gave birth, he was not sleeping. He was flipping out. Now, whereas for me, they could put me in a hospital and give me help. He didn't get the help because he's a man. He got arrested, but he didn't get the help mentally. And it led to their divorce. And I
We have
think
a
that
lot of work to do in our mental health system.
and I think that people forget that the men also go through it.
Well, and the entire family is affected.
Right. It is nobody exists in a bubble by themselves, right? It's the whole family. And as Dr. V was saying, only 15% of people are getting treated. You have to think about all the children that are being mothered and parented by somebody suffering with mental health issues. It's really hard to give when you don't have enough for yourself. Dr. Nguyen, how about from you, some of the specific ways that you think that we can reach out better to help people when they are having a crisis or when we suspect they may be struggling beyond their level of being able to deal with it?
Yeah, well, I'll just dovetail off of Eva's point around men and from a perspective of also being able to have them as allies for when women are struggling with mental health needs and needing support, and particularly in the situation of when we're talking about postpartum depression and really recognizing that it's a family systems challenge, right? And maybe there's an identified patient, but that we need to be able to reach out to our allies, including our husbands and our other male friends and colleagues and male networks so that we can continue to get that support and also change the course of what it looks like over time. But more specifically, I would say, like, it's been even additionally challenging because of COVID. And that one of the things as health systems that I think all health systems have done is rapidly be able to offer telemental health services. And it's allowed women who've had babies be able to come to these appointments more consistently and regularly without having to get their kids into a car seat, into the car, and or arranging for babysitting and those types of things. And so I do think that that has really helped and will continue to. And I'll expand on that to say that there are also digital tools or other digital tools or technologies that can be an adjunctive or sort of parallel support for women and or others that are struggling with mental health needs to be able to, one, better understand what's going on with themselves, share that with others in their network, and then do some really specific things in the moment to help support themselves. Oftentimes, as we were talking about before, we get too much into our and our automatic thoughts about who we should be or who we need to be show up. And so things like practicing mindfulness and showing up to and just pausing. I often tell my kids, smell the roses, take a moment to smell the roses, and then blow out your candles, just as a way to practice deep breathing. And that can help level set. And then you can just ask yourself, right, what's going on here? Am I responding to something that's happening in the moment? Or am I responding to something that's happened in the past or a worry that I have about the future? And so that's, I think, a tangible thing that can be quite helpful. Ava mentioned exercise, routine exercise, or engaging in activities that you find pleasurable and fun is really important, especially when you're not feeling well. So a practice that I do myself is I have dessert with every meal, including breakfast. And that's how I regularly engage in a pleasurable activity. And another tip that I'll share that I think can be helpful is when we're feeling down, we often want to retreat or withdraw. We're not going to want to do things. We're not going to want to talk to people. And so I engage people to remember opposite action, which is to do the opposite of what your body or your mind is telling you to do in that moment. That can be quite a helpful to sort of reminder of do the opposite of what you're wanting to do. So if you're wanting to sit or withdraw, go out, engage. You're not going to want to do it. You'll find that after 5 to 10 minutes, it's really going to help improve your mood.
So that was 3 great concrete tips. Stop and smell the roses, and then blow out your birthday candles. What was it? What was the second one? Help me with that. And then just think: is this? And then recenter yourself. Is this problem like right now, in the past, in the future? What can I do for right now? And have dessert with every meal. Treat yourself.
You got it.
Yeah. Okay, Dr. V, you have some like hardcore takeaway tips for helping with our mental health, like throughout the day that we can reset?
Absolutely. I gave birth to I'm going to call her a bad baby. So my first baby was a tough one. It's amazing I had more children after her. And one of the things that I did after coming back to work was, I think, recognizing how many women really struggle with all of these different challenges of having a newborn, of coming back to work, making these transitions, figuring out how to do it all. And so one of the things I talk to patients about, and I found helpful after having my first child, was breaking down mindfulness when things feel really overwhelming. And so one of the best ways of doing this is saying things like, break it apart in 3. What are the physical sensations I'm having right now? And this works for having a newborn, but this also works for any moment where we're just feeling really overwhelmed. So what are the physical sensations? Is it a tightness in my chest? Is it a squeezing in my shoulders? Is it my stomach dropping? Is it my palms sweating? Taking a moment to just be aware of just the physical sensations. Afterwards, what are the emotions I'm having? What are the feelings themselves? Am I angry? Am I scared? Am I uncertain? Am I confused? And I can be all of those things at once. And so, again, taking a moment to break it down and say, what are the feelings? And last but not least, and to Dr. Nguyen's point, is then looking at the thoughts in a different light. What are the thoughts that are going through my head? Because often I'm being hijacked by a thought that's being controlled by my emotions. And so instead saying, okay, my thought is, I'm feeling out of control. I can't do this. I'm not a good mother. I want to, in the example of a baby, I want to put this baby down and walk outside. I'm so overwhelmed. And it's amazing how fewer teeth that moment has when we can break it down into bits and pieces. And so I think that that's a huge piece of the puzzle for a lot of us that we can do right now or any time that we're feeling overwhelmed. And outside of that, I think we just have to talk about it. We've got a really normal happening.
Yeah, break it down.
And for
I like that.
moms,
So
try
break
not
it
to be
down.
perfect.
Yeah.
And for moms,
Yeah.
try not to be perfect. Like there's an obsession, especially right before you have a baby, you have these plans. You're going to give your kid the perfectly healthy child. If you're a yuppie mom, which I admit, you read that Bringing Up Bebe book, How to Raise Your Kid the French Way, and reduce the salts and and all. You want to do the French way, but you want to breastfeed because the French don't breastfeed. And you have these obsession, like you've read all the baby books, and understand that none of it's going to actually happen. And by the time your kid's 3, your kid is going to have a McDonald's. And television is going to be the babysitter occasionally because, well, you need a break. And don't feel guilty. And your kid's going to be happier if you're happy. So don't try and be obsessed with being perfect.
That's
As
a
someone who
fantastic,
really
right? Your kid is going to be happier if you're happy. Yeah. So how do we tackle stigma? How do we, we've all said it's important to talk with people. It's important to reach out for help. How do we do that? How do we reduce the stigma that serves as barriers for so many of us to get the help that we need for ourselves? Dr. V, you want to kick us off with that? Stigma.
Yeah, I would argue that the women listening right now have a greater responsibility for this than most. And here's why. Going back to my superwoman syndrome comment, I think that a lot of times it appears to other people like we have it all together. I think particularly for people who are working moms or women in leadership. And so because of that, I do think that we have a greater responsibility to peel back the layers on what people are seeing or maybe perceiving and the reality. I think that the more honest we can be in a way that is designed to be helpful and joining, the more vulnerable we can be, the more authentic we can be about the hard points, allows other people who are watching us and potentially looking up to us and thinking that we've got it all together to do the same. And so I think that there is a trickle-down effect that we all need to really think about. And I think every time that somebody talks about how wonderfully we do something, if it was hard, it's okay to own that it was hard. I was just at my kid's soccer game, and one of the moms was responsible for the soccer treat, and she brought this perfectly designed little bag with each of the kids' names on it and these like individualized cookies that had been, it was amazing. And I'm sitting there thinking, did I do apple slices? Was I supposed to do that? And just having this moment of what was I doing? But I think that if we do it and we do it well, let's own it. But let's also talk about the real stuff too, not just how it looks on the outside.
Yeah. No, I think that is so real. And people have mentioned this before. Social media has made it all worse, right? Because we see that, we're like, oh my God, she did that and that and that. And yeah. Dr. V, stigma, how do we start knocking it down? I'm sorry, Dr. Nguyen.
I agree, and I think as we're talking about the social media aspect, I do see actually there's an opportunity also to use social media to promote destigmatization of mental health, and that I think there are some young stars today that have been very open about the challenges with childbirth and that their bodies aren't perfect. And it took them 6 months and lots of work with personal trainers, right? And all of those things. So I think some of that is also happening more publicly as well, and begins that conversation, to Dr. V's point, about just being honest that what you see, it takes a lot of time in the back end, right? There's a lot of staging that happens. And as you mentioned, Senator, at the beginning of this, we're in our Zoom calls, we have our professional tops and our comfortable bottoms on, right? Because we want to, there's a lot of impression management that happens. And maybe particularly for women, where beauty and external appearance was prioritized over maybe our professional accomplishments, that is perhaps more important to really acknowledge that we all, it takes a lot of work to present a certain way, and that it's okay not to. To Eva's point about perfection, it reminds me actually of Bridget Jones' Diary, where, if you all remember the story, there's a scene where I can't remember the person's name in the show, but the actor's name is Colin, and he says, I like you just the way you are. And so maybe perfection is just the way we are. And so I think that that's also another helpful way for us to think about the perfection sort of component. But in terms of mental health and destigmatization with health systems, I know we're doing more screening, like in primary care settings, as well as when women are going to their OB appointments. And I think that's really helpful, because that's really where folks are, right? The front door is in primary care. And so as we're improving consistent screening around that, we're encouraging open conversations, we're offering resources, and I think that is tremendously helpful. I also think we can begin to address the stigma question by inviting sort of more peer community workers into the sort of traditional health settings, where we can see someone who's like us, right, working in the health setting, who can share their personal story. When we look for a reference for something, what do we typically ask for? We ask our friend, and we go to the place that our friend recommends. So in a health setting where it can be quite intimidating and new, it's really helpful when there's, a peer support staff that looks like us, that sounds like us, that can help share us, guide us in the experience. And I think it does open conversations a little more quickly as well.
I have been lucky during our legislative break to be able to get out and visit a lot of programs. And I was visiting a program in Stanislaus County where they have a really healthy Moderator program, where you have, paraprofessionals who are going out, making relationships, especially with our non-English speaking communities, and just, going to this kitchen table, right? And then I think our healthcare systems and our mental health care systems having to expand a little bit away from seeing it just as a professional versus those people who are really going to get you into the door, and being able to build those relationships. Because I think hopefully we all agree that we can't help anybody at all if we don't have just the basis of relationship, which I think goes back to both your earlier points about being our authentic self. And the more we're our authentic self, the more people are going to feel okay reaching out to saying, I'm having trouble too. Eva, when you finally were able to get help, was it your husband that did an intervention? Was it friends? Was it families? Like, who finally said, and who were you actually able to hear that, okay, you're right, I do need some help?
I had felt like there was something wrong, and I didn't know what it was. And I kept telling my husband, I'm going to go away. I'm going to go to the hospital, and you have to take care of the baby. And my husband kept saying, no, you're not. No, you're not. You're just getting post. And I've been crying and stuff. And then I actually went on a walk in my neighborhood, and I talked to a neighbor who happened to work at UC Davis. And she saw that I was talking fast, and I got hospitalized. Like, she told me to go to the emergency room at the hospital, and they didn't. In my case, when the bipolar hits and when I do have the mania, I talk very, very fast, and I have the emotional light bill. And if you are a new mom and you start talking really fast and going on, they will hospitalize you quite easily. You don't have to have any other symptoms. I wasn't suicidal. I wasn't homicidal. You know, yeah. Afterwards, I did
Yeah.
get quite depressed, but yes, my initial was that. But what was
Okay.
help but what was helpful was everybody, wanted to keep it a secret that I'd been to a mental hospital. I didn't want anyone to know. I was so ashamed. But my mother knows everybody in Sacramento. It's a small town. I'm not. And she had told everybody. So I get out of the hospital and everybody knew where I'd been. And well, when everybody knew, I started being open about telling people. And then I was shocked by how many of my friends, and I'm not talking about friends I met through mental support groups, which I did do too, but ones I met taking my kid to Spanish for toddlers, I took my kid to the library story time. I did all of the things you take your kid to. How many had gone through similar instances? Like one of my friends I just randomly met in my neighborhood, she had been almost hospitalized herself, and she had disappeared for a while because she had gotten a bipolar diagnosis. And yeah, it made me feel a lot less alone. And it made me feel like and the ones I found the most tragic were the ones who a year later, 2 years later, told me how depressed and how messed up they were. And those ones often, they didn't react by getting help. They often got divorces. It was too much pressure on them.
Yeah.
But they were able to not get help. And it was and they realized how much they missed. And in their child, you miss the beginning of your kid's life. And it's hard, even if, and it is amazing how medication really can make a difference. And just, yeah.
And it sounds like one of the other things that you're saying, that not even focused on the mental health issues, but just reaching out more to all kinds of different groups. And I think going back to what Dr. Nguyen said earlier about doing the opposite, which, and like trying to back up a trailer, right? If you do it the way you think it should be going, you're going to jackknife that trailer, but you have to do the opposite. And so like when you probably were feeling depressed, like not wanting to do things, like going out and going to mommy's group or going out to the library or going out to all these things, you know, is pushing ourselves to do the opposite of what we want to do. But that just opens up the opportunities for somebody to be able to have those conversations and intervene. Like, I don't know about you, but sometimes when I kind of force myself to go and do things that, and you know, I just wanted to stay home and focus on something else, I get like the biggest gift of my day because I have a fantastic interaction with somebody that just makes me feel good. Like, you know, just a positive interaction with someone at the dog park or at the grocery store or anywhere, but just like making yourself get out sometimes is half the thing. And then running into people who can say, hey, you feeling okay today?
Seeing people always helped me, no matter what. And that was the harder thing with COVID. Couldn't see people, or I saw them through Zoom. And I watched a lot of moms really struggle. Like I'm in an online lactation support group, which is the craziest thing on earth, because you know you can't like nobody's showing you how to do the breast or anything. It's online, but it is a lot of moms telling their stories, and it's a support. And a lot of new moms are like, and I made actual friends there going, you know, I'm struggling, not just the lactation, but like, I'm just sad. I could be like, you know, go to your doctor. And it's a lactation support group, but it's new moms and they're kind of looking for mental illness. I mean, I think that's what they're looking for, signs of mental health. Like that's kind of what
they're already saying, I'm willing to make myself vulnerable here with you ladies.
It's a screening thing, but
yeah,
it's been a really good support and seeing.
Yeah.
And
good.
Yeah.
Okay. Well, and we have a bunch of questions that are coming in from the audience. So if it's okay now, we'll transition because we got a little bit of time left to do some of these. And speaking of lactation, not lactation, one of the questions is, what about stress and social pressure for women who do not have children? I don't know, Dr. V, Dr. Nguyen, who wants to take a crack at that?
I'm happy to start.
I'll start. I mean,
go ahead.
I was just going to say, it reminds me actually of, for those of you who know Sextima City and the character Samantha, she's one of the characters in the show who chose not to have a baby. And one of her storylines is she had breast cancer. And the doctor told her that there were women who did not have children had higher risk of breast cancer, of developing or getting breast cancer. And she really found that messaging offensive. And so I think this goes back actually to the beginning of our conversation around expectations as women, and that we are seen as those that we're meant to, we're almost sort of groomed to have children. So who are we if we don't, if that is sort of our primary sole purpose on this earth, right? And so I think it does go back to that expectation and saying, hey, the world that as we know it today, the world that I live in today is different than the world 20 years ago, than the world 50 years ago, and the world 100 years ago. And so I want, I can let the noise outside of what that expectation is impact my own personal choices, and just notice how the noise outside around that impacts my personal choices, and reflect on what it is that I really want. And so I think calling that out as, maybe a bias, right, that we might have. And then saying, and then I'm going to reflect on who I am and my personal values, and decide for myself what I like to do moving forward in terms of my, having children, having a relationship, what that looks like for me. But I do think it's noticing those assumptions and then challenging them, and being true to who we are, in terms of what we want, how we want to live our lives.
And it's interesting as an older lesbian and somebody who came to parenting later in life. I can tell you, if you have more space, people want to fill it, because I've taken care of so many older people, right? Because the family's like, well, you don't have kids, you can do it, right? So then there's all those extra expectations that I think oftentimes women with kids don't get. People just think we have all this extra space that you don't really have. I mean, space is taken up. Dr. V, did you want to comment on that? I
was going to add Senator Eggman. Also, there's the other side of that, which is often people think because you have children, you know how to take care of people, so you might as well take care of one other adult person. Yeah. So then that happens too. So there's no winning for us as women around the campus.
No. Women who do too much just keep doing too much. Let me see. There's a lot of questions. Well, Eva, let me ask you though about stigma. Like, what would help reduce some stigma?
Honestly, honesty and being honest about the biggest stigma that I've seen is medication. And people are like, "Oh my God, you're on medication. You need to do this natural. You need to do," and understand that people can't do that. And it is the cliche, like you wouldn't tell somebody who has diabetes, "Hey, let's try without insulin."
Right.
But they do it with medication. It's like, could you try exercising? Can you try being happy? Can you try all of these other things? And I did that. Oh God, I tried so hard to go off meds. And I learned I honestly can't do it. And it's been hard.
And that's okay, right? And get to the point where that's okay.
And no, it is okay. And I should, but I do hear from some very close friends and very close people. Like my friend said that I needed to turn to God and smoke a bunch of pot, and that would fix my problems because it's natural.
When they start with, you need to, right? Close the ears. You need to close the ears. We just had a massive tree from our backyard removed, and some of my friends came to watch, and they all had suggestions on what the worker should be doing. And I'm like, oh yes, with your vast experience in taking out massive trees around power lines, why don't you go give them some advice, right? I mean, people want to give advice about all kinds of things, just kind of based on, I'll tell you what you need to do, right? So, and I would just, a tip for people too, as you're trying to help people, be curious. Like, want to listen to people's story and understand it without going into that. You need to do this, or have you tried that? Just listen. Just listen to people sometimes. Yeah. And then people were asking, like, how do we get more people into the mental health field? And somebody was asking about a tuition reimbursement program. And yes, I will say that works. We did that through the Mental Health Services Act early on with some of the more upfront money. I think that can be reintroduced. We're trying as many things as possible through the budget to do more incentives. And I'll also just just to say, this is seen as women's work, and we don't value it in the same kind of ways, right? We don't value women just kind of in our role as trying to do everything. There's not national leave. There's not all the things that go into place in societies that say we value families, we value women, we value children, we value caregiving. We don't have that. So as we're trying to build our systems to create more of that, what are some ways that you think that we can attract more people into the field and to stay in the field? Because it is hard.
Insurance. And the one thing, at least for the most amazing doctor I have is an OB psychiatrist. She unfortunately cannot get paid to be both an OB and a psychiatrist. So she does her psychiatry for free. She works out of the OB department at UC Davis.
Yeah.
You know,
we had a whole conversation about same-day billing. We'll come back to that later.
And she did a residency in both obstetrics and in psychiatry. So she's actually knowledgeable about both. Finding a doctor as a woman, finding a doctor who is familiar with obstetrics and psychiatry is absolute hell. And now I have insurance. I have I have good insurance. But to find the psychiatrists don't want to touch pregnancy because of the risks to the unborn. And the obstetrics, they go, oh, you need it, but they won't touch it either because they just want you drug free. She's the only one who can do both. They need people. And unfortunately, insurance doesn't pay for it, so she does it by herself. She could make more money as a psychiatrist. She likes to work in OB. And
Yeah. And I will say one of the things that we're able to do for the budget is extend Medi-Cal for the first year after birth for maternal mental health.
So that's very amazing.
But we've just got a couple minutes left. Dr. V, Dr. Nguyen, do you want to close us out with any just kind of like, and clearly we could have done this for hours and hours and hours. I think we just barely scratched a lot of surfaces. But any just like closing thoughts or tips, both on people taking care of themselves, helping their friends, and getting more people into the field? Any one of those three parts. Dr. V, let's start with you.
I was going to say, I'll try to do all three in 2 minutes if I can pull it off.
Because you're a woman who does everything.
Yeah, exactly.
Yeah.
I think the first thing I would say is to be aware of the shoulds. We should ourselves all the time. And those are the rules. And so I would just pay attention to them. Whether you are a mom or you're not a mom, you're a woman. And we have more of these than our male counterparts. And I just think that that's a very helpful thing to pay attention to. The second thing I would say that I hope that we can all really consider and think about really carefully is how we engage people in care, particularly in underserved patient populations. We as a country have the lowest rate of mental health providers in primary care, which is typically where people seek services, including for psychiatric disorders. And so I think the more that we can encourage, incentivize, and support primary care departments, both as an OBGYN and as an adult and family medicine provider, and in pediatrics, frankly, to be able to have mental health providers in their departments providing that care, and ideally providing it same day when possible. When we can catch things early, it makes a huge difference. I mean, think about it. We don't wait until diabetes, hypertension, cardiovascular disease gets out of control before we start to manage it, right?
Yeah.
Right. We deal with it immediately. If you go to your doctor and you have diabetes, they're going to start treating you for it. We need to have the same societal expectation around mental health and addressing it early and often. And one of the best ways we can do that is by normalizing it and putting in primary care, and not just in large cities and in large systems where the access is a little bit easier. I'm talking about everywhere. And so that's my big soapbox. So I'll climb back down now.
Right.
Let Dr. Nguyen talk.
Right. Dr. Nguyen, jump up on your soapbox and lay it out for us.
Yeah, I'll try to be really as impressive, but I don't know if I'll match that. So I would say my first maybe takeaway is stay in the present moment. Notice when what we're doing today is because of something that happened yesterday or a worry that we're thinking about tomorrow. So enjoy what's happening today, because the moment is going to pass and you can't get it back. The second piece around just sort of mental health is, I would say, mental health is human health, and without mental health, there is no health. Mental health is equally as important as physical health, and so the more we're able to talk about it the way we are today, the way Eva has shared and shown her vulnerability to her friends, her family, her community, it's really been a great role modeling for others to be able to say, look, I can do that too, and that it's much more common than I think, and it's not just me, and we're not alone in all of this. And I couldn't agree more with prevention and early intervention, and going back to screening and primary care, and supporting the work there. And to the extent that we can really support training programs, and maybe even go back in early education as primary school and elementary school, and promoting mental health positions and roles. I don't know if I totally knew what a psychologist was, right? When I told my parents this is what I was going to be, they said, can you prescribe medication? And if not, why are you doing it? Because it takes you 6 years before you can finish, right? And I just think more education about work and mental health will be really important as we continue to grow and expand the workforce.
All right. Well, thank you to everybody. And that took us right down to the right on time. So I want to thank everybody for the fantastic conversation. Again, some takeaways: do the opposite, reach out to people, eat dessert with every meal, stay in the present, don't shit all over yourself, and don't let people shit on you. And we need to work to collectively to expand access to our mental health system, and really, I think, put our effort behind the value that we find in families and women and the giving of care and the living of life. So thank you all very much for this great conversation.